Hello friends, I'm Dr. Murtaza Adeeb. I am an orthopedic surgeon specializing in joint replacement surgery, particularly total knee replacement and total hip replacement surgery. I practice in Pune in India. So today we're going to talk briefly about what to do when you go home after a total knee replacement surgery and what common questions people have. So the first question is, how will I get home? Can I go home in my own car? Do I need an ambulance to go home? So the simple answer to that is that you can go home in your own car. As long as the seat is a little high, you can go home in your own car. Preferably sit on the passenger side in the front, because that is a special bucket seat and it has a better constraints, etc. The second thing when you go home is what medication will I have to take when I go home from hospital. So the medication that you have to take when you go home after a total knee replacement consists of an antibiotic, which is usually prescribed for 3 to 5 days, painkillers, which can be either 1 or 2, and a medication to basically thin your blood to prevent clots, etc. And that could be either a tablet. Sometimes people give injections as well. I usually prefer a tablet. I usually start off with a tablet called Xarelto for the first 2 weeks, and then I switch to EcoSprint 75 milligrams for the next 4 weeks. So total anticoagulant therapy for 6 weeks after the surgery. This will be on top of your existing medications. So if you have any existing problems like diabetes, blood pressure, etc., there will be separate medication for that, and this medication from the hospital specifically for the total knee replacement. Third question commonly is that what do I do about my wound when I go home? So basically wound care is quite important to prevent any complications, and the best thing is to keep the wound dry and keep an eye on it, and preferably do dressing, a sterile dressing, maybe call a nurse in and do it every 3 to 4 days. And then after 2 weeks, usually the stitches come out, so you'll have to come and see the doctor after 2 weeks to remove the stitches in hospital. Do I need any physiotherapy at home? So the answer is that yes, you do need physiotherapy at home. The physiotherapy will start soon after the operation whilst you're still in hospital, and this has to be continued when you go home. And preferably again, physiotherapy should be done every day. If it is supervised, that's fine. If it is not supervised, at least you can do the exercise on your own, at least once or twice a day. If you manage to do more than that, it's better for you. The fourth common question is that what kind of work can I do at home? So basically after the operation, usually for a week or so, it will be a little difficult to do even basic stuff at home. So you will probably need some help getting into the bathroom, etc. And ideally you should have some railings in the bathroom to hold on to. Also some railings in the passages at home, just to give you some extra support. And you may require a frame to walk or a stick to walk at home. The last question people usually ask is that when can I get back to work, for people who are actually working. It depends on the job that you do. As I said, it takes approximately 2 weeks for the stitches to come out and probably another 2 weeks to recover from that. So I would say if you have a sitting job, you could probably get back to work after 3 to 4 weeks. If it is a more active physical job, then I would say probably after 6 to 8 weeks. If you need any more information, kindly contact us. Thank you.